Welcome back to your Pediatric Dentist channel Tiny Teeth Talks. If you are new to this channel, subscribe the channel, and for details of this channel visit the bio section, or you can also check out my first video. In previous part we discussed symptoms of teething. Today we are going to discuss management of teething. Memar et al. Presented two main methods, pharmacological and non-pharmacological, which have been recommended as treatments during tooth eruption. So first, non-pharmacological method. In that, the first therapy is teething rings. Teething babies love to chew and bite on anything. Teething rings are made up of different type of materials. Approved teething rings do not cause cavities or choking. Many type of teething rings include first, solid teething rings made entirely from a single material without any liquid or gel fillings. Gel filled teething rings contain a gel like substance intended to provide a cooling effect when refrigerated. If leaked, potential ingestion risks are there. Water-filled teething rings filled with the sterilized water. These can also be cooled to help numb sore gums. Materials used in teething rings. First, plastic, commonly used due to its versatility and ease of cleaning. Silicone, soft, flexible and free from harmful chemicals like BPA that we will discuss later. Wood, natural and durable, often chosen for its eco-friendly properties. Rubber, provide a soft and chewy texture suitable for teething relief. Safety consideration. While teething rings are designed to be safe, certain materials have raised health concerns. We saw BPA. So first cautious material is BPA, bisphenol A. Despite many products being labeled as BPA free, studies have been detected BPA in several teething toys. So BPA is an endocrine disruptor linked to various health issues. These disruptions has been linked to developmental, reproductive and neurological issues. Studies suggest that BPA exposure may increase risk of obesity, diabetes and cardiovascular disease. Frequently check teething rings for sign of wear or damage to prevent ingestion and choking hazards. Phthalates. These chemicals used to soften plastics have been found in some teething rings. High exposure level may pose health risk, leading to call for stricter regulations. So in children, phthalates have been associated with asthma, allergies and developmental problems. Paraben and antimicrobials. Compound like triclosan and triclocarbon found in some teethers can leach out and may interfere with hormone functions. So paraben can also cause skin irritations and allergic reactions, especially in individuals with a sensitive skin, and some antimicrobials like triclosan are linked to thyroid dysfunction and other hormonal imbalance. Teething rings should be attached to infants' clothing and not tied around the neck, as strangulations could result. Other than teething rings, hard unsweetened rusk made from flour and wheat with no sugar or sweetener can also be attached onto the infant's clothing. A variety of fresh and frozen fruits and vegetables have been used by teething infants, anything from peeled cucumber to frozen bananas. Although many parents have strong views about providing infants with a pacifier at any time, many teething children are comforted by a pacifier will chew the teeth to provide temporary pain relief. Coming to the pharmacological methods, the first, topical agents. These group of medicaments include local anesthetics and minor analgesics. Parents should be advised to wash their hands thoroughly before applying topical agents directly to the painful area of mucous membrane. These are the topical agents available in the market. Lignocaine based products. Lignocaine hydrochloride is a local anesthetic that is rapidly absorbed through the mucous membrane, giving prompt relief from pain although temporary. Around 7.5 mm of gel should be placed on the clean finger or cotton bud and rubbed onto the painful area. Although 20 minutes should be elapsed between approaches, only 6 applications should be used each day in order to prevent the systematic toxicity. Choline salicylate based products. So salicylates are regarded as a minor analgesics and are similar to lignocaine hydrochloride in that they penetrate mucous membrane readily and give prompt pain relief. Their main pharmacological advantage over lignocaine based preparation is that in addition to provide analgesia. They are also anti-inflammatory and antipyretic, thus reducing swelling. For children over 4 months old, 7.5 mm of gel to be massaged onto the painful area not more often than 3 hourly with a maximum of 6 applications daily. Systemic analgesic. A sugar-free paracetamol elixir is the systemic medicament of choice in teething because of its action in reducing pain and pyrexia. Recommended paracetamol dosage is 3 to 12 months old babies 60 to 120 mg, 1 to 5 years 120 to 250 mg. These doses are repeated at 4 to 6 hourly intervals with the maximum of 4 doses in 24 hours. Alternative non-pharmacological holistic therapies like acupressure, aromatherapy, massage, and homeopathy have been suggested as giving relief from the symptoms of teething. Starting with the acupressure. So acupressure requires the parent to apply pressure to certain key skin points, providing immediate if temporary pain relief. Commonly suggested acupressure points for teething relief. First, L1 for Hagu, which is located between the thumb and index finger. ST36, which is Suzanne Lee, found on the lower leg below the knee. GB20, which is Feng Chi, situated at the base of the skull in the hollows on either side of the spine. BL10, which is Tianzu, located at the base of the skull between the two vertical neck muscles. Practitioners recommended applying gentle pressure to these points for 10 to 15 seconds, repeating as needed throughout the day. Aromatherapy uses the essential oils, clove oil, tea tree oil, olive oil, often with the massage to neutralize the inflammatory mediators produced during teething. Before application, 0.5% dilution is recommended, equating to 1 drop of essential oil per 2 tablespoons of carrier oil, which might be coconut or jojoba oil. Apply the diluted mixture externally along the baby's jawline, avoiding direct contact with the gums or mouth. Seek guidance and apply patch test before using it. Alternatively, chamomile oil may be placed in an aromatherapy diffuser in the infant's bedroom. Some researchers don't recommend to use of aromatherapy on children below 3 years. Homeopathy treats the whole person, not solely the illness, and is becoming a more popular method of treating the symptoms of teething. The active ingredient in Aston's and Parsons infant powders is Matricaria tincture 4 mg, a carminative related to chamomile. Other homeopathic medications including Tida and Boots homeopathic teething granules contain 6C potency of chamomilla. One sachet should be poured into the infant's mouth every 2 hours up to the maximum of 6 doses in 24 hours. The main indication of these products are to soothe the child, correct the motion, relieve restlessness, fretfulness, and similar troubles incidental to teething period. All potentially useful benefits during teething. General advice. Parents should be advised that a number of outdated practices are potentially harmful. Adding or dipping sugar, honey, or jam to feeding bottles has absolutely no pain relieving effect and is highly carcinogenic. Parents should be advised that the repeated application of alcohol to the mucous membrane of an infant is ineffective as a topical anesthetic, and due to an infant's small body weight may lead to hypoglycemia. Teething remedies should be kept well out of reach of all children because of added flavorings. Children can unwittingly overdose themselves. Medicines including teething remedies should never be added to food or feeding bottles, as parents cannot accurately control the dose ingested. Stewart's approach to teething. First, give the child teething objects to bite. Cold objects bring greatest relief. Teething rings can be kept in fridge. If pain is troublesome, use the appropriate dose of paracetamol elixir, preferably sugar-free. These may be given regularly every 4 to 6 hours. If additional analgesia is required, lignocaine-based teething gel should be used. Reassurance can often be one of the most effective methods of calming stressed teething child. Most parents prefer to avoid using pharmacological preparation during teething. However, a wide range of effective topical and systemic preparations are available when local measures fail to provide relief. But please consult before use. These are the references. If you want this as PDF or any other PDF, just like, subscribe and comment your mail ID with the topic and I'll send you the PDF. New videos on Sundays for now. Also, we will put lots of important things on shorts soon. So subscribe and press the bell icon for that. Like, share, subscribe. Thank you.